My name is Kim Kerr. I'm a pulmonologist and I work at the University of California, San Diego. I'm involved with the PTE program there. Ctf stands for chronic thromboembolic pulmonary hypertension. We've all probably heard about people who've had blood clots in their legs or people who've had blood clots that have gone to their lungs. There have been some famous people who've had what's called pulmonary emboli, and it happens all the time in the United States. Estimates of up to 500,000 people a year in the United States will have venous thromboembolism, pulmonary emboli. The vast majority of those patients, the clots will be dissolved and there's no ongoing significance for those patients. There's a small subset of those patients, though, who the clots don't go away and actually they develop pulmonary hypertension. These clots are no longer fresh clots, they're forming scars in the pulmonary artery, and it puts a strain on the right heart and people get short of breath and they develop symptoms of right heart failure. We call them chronic blood clots, but they're really scars. And the way I explain it to patients is for instance, you break your leg, you put your leg in a cast, and because you're not moving your leg, you develop a clot in the vein in your leg. And some of these patients, or a lot of these patients, that clot in the vein breaks off and goes to the lung and lodges in the lung. And most of the time, your body will break up most of that clot in your lung. There's something very unusual about a subset of patients. So probably we don't know how many. Estimates are 1 to maybe 8% of those patients. Something different happens, and the clot doesn't break up. It really organizes into a scar and doesn't go away. And it pulls down on the pulmonary artery. So it raises the pressures in the lung, and you develop right heart failure. What I explain to patients is these aren't fresh clots anymore. They're very different. So I say, you cut your hand and you bleed. And when the bleeding stops, you have this jelly-like clot over the injury. And then it forms a scab. And when the scab falls off, you have this white scar on your skin. And that's what this looks like in the arteries now. Not like that jelly clot we all imagine as a clot, but it's really more of a scar. And that's why we can't dissolve them with clot busters. We can't suck them out. The only way to remove them is to have a surgeon go in and cut them out. Recently, in the past 10 years or so, there's been a significant increase in interest in the diagnosis and treatment of patients with chronic thromboembolic pulmonary hypertension. People are just really excited about this disease. It's somewhat a delayed but parallel course to the interest in pulmonary hypertension. 25 years ago, there were not many people interested in the disease. There was not much awareness of it, and there weren't many treatments for it. And so I think as drugs became available for the treatment of pulmonary hypertension, doctors were more interested in it, and hence awareness increased and they began to look for the disease. Perhaps that's part of the story with Ctef as well. It's still the recommended treatment for operable patients is for them to be treated with surgery. However, recently the first drug was FDA approved for the treatment of Ctef when patients weren't operable or if they still had residual pulmonary hypertension after surgery. So we've had a lot of efforts from industry as well as academia trying to raise awareness of this disease and the treatment of it. So the Ctf Registry is really in its infancy at this point, but we're very excited about it. And this was born out of our concern that a lot of patients may have to travel a great distance to get their surgery, and then they go home, and it's hard to get follow-up information on those people. We also realize that there are patients that are never referred for surgery, even though they have Ctef, and what happens to those people. So we formed a steering committee consisting of a number of it's a multidisciplinary team. So we have cardiologists and pulmonologists and surgeons and an epidemiologist. And we came up with a bunch of questions we wanted to answer about this disease. And so we began enrolling in April 2015. All our sites are activated. We have 30 sites throughout the United States that are participating in this registry. We'd love to have more. We really would. There are a lot of great pulmonary hypertension centers out there, but we were limited for financial reasons. So we were trying to get good geographic representation throughout the United States. And we're just enrolling newly diagnosed patients with Ctef at this point. So people who've been diagnosed with Ctef within the previous 6 months. And we're gathering baseline information like their symptoms and what kind of doctors they saw. We also ask things like, what other diagnoses were you given, essentially the wrong diagnosis, before someone made the right diagnosis, and what kind of doctors were you seeing? We think that information will be helpful in targeting education in the future to medical providers. And we're capturing information about the therapies they're getting and their response to therapy. And something that's a little bit unique about this registry is we're looking at quality of life. So our subjects in the registry are filling out quality of life surveys for us every 6 months. So we just don't want to know if, for instance, if you have surgery or you start on a medication, is your 6-minute walk distance better? We want to know, is your life really better in response to these therapies? So this will go on. We're going to enroll 750 subjects, and the registry will end when subject 750 has been in the registry for 1 year. We anticipate that will take about 5 years to complete this project. We're excited about that.